Hi Zhenhui, so it's Adrian here, Coach Adrian, just calling you to inform you of our first session will be due in 3 days. So for the first session, we'll just be doing a quick pre-participation screening lah. Okay, so just come in your comfortable attire, and if you need anybody to accompany you home afterwards, please make your personal arrangements. So for the pre-participation screening, I just need to collect some information for you, but don't worry, the information you give will be kept strictly confidential. And another thing is that you can withdraw from the screening at any point of time without any consequences or whatnot lah. Okay, see you in 3 days time. Thank you. Hello Wei, thank you for coming to our first session, which I called and informed you about 3 days ago. So just to introduce myself again, my name is Adrian and I'll be your fitness instructor, okay? Yeah. So as you know, today we'll be doing a pre-participation screening. So this pre-participation screening is actually essential as it will help me understand your health as an individual better. For example, can help me identify if you have any health conditions or symptoms of underlying health conditions that will require you to be medically cleared by a healthcare professional or to perform physical activities in a more medically supervised environment, okay? Before we start our physical activity. So this pre-participation screening will also help me determine the level of exercise intensity which you are cleared for, because we do have 3 different levels, which is light, moderate and vigorous. Okay. In the case that you are cleared for this screening, we can continue on to our fitness assessments in the next sessions, and these fitness assessments will help me determine the different aspects of your fitness and then ultimately the exercises I should prescribe for you in order for us to best meet your goal, right? Okay. Do note, during this screening, you are free to stop and withdraw from the screening at any time, and any information you give me today will be kept strictly confidential. So with that being said, do I have your consent to begin?
Yes.
Okay. Okay, Chandra. So for step 1, the first thing we'll be doing is the PARQ form. So this is essentially like a health questionnaire. So what I will need you to do is to just complete a certain section of the PARQ form. And you have any questions regarding the form, do not hesitate to ask me, and we can begin. Before that, do you have any questions?
No.
Okay, then we begin now, okay? Okay, Chunhui, since you have completed the PARQ Plus form, I'll just run through your answers really quickly. Okay, so for question 1, has your doctor ever said you have a heart condition? You said no. If you felt any pain in your chest at rest or daily activities, you said no. Do you lose balance because of dizziness? You said no. Question 4, have you ever been diagnosed with chronic medical condition? No. And taking prescribed medication? No. Do you currently have any bone, joint or soft tissue injury or problem? You said no. And lastly, has your doctor ever said you should only do medically supervised physical activity? No, right?
Yeah.
So, now that you have completed all the questions and you have answered no to everything, we can move on to step 2. Okay?
Yes.
Okay, Tenhui, for step 2, now I'll be checking for any known diseases that you have. So Tenhui, do you have any cardiovascular, metabolic or renal diseases that you know of?
No.
Okay, so some examples of these diseases will be like heart attack, high blood pressure, diabetes, renal disease or congenital heart disease. Do you have any of these? No, huh? Okay, so moving on to step 3, I'll be listing signs and symptoms. Okay, and you let me know if you've experienced any of these signs and symptoms before. Is that okay?
Yes.
Okay, so have you experienced any pain or discomfort in your chest, your jaw, arms or any other areas?
No.
Okay. Any chest discomfort with exertion?
No.
Any unreasonable like breathlessness?
No.
Have you ever felt like dizzy, fainting or blackout?
No.
Okay. Do you have any like case of ankle swelling?
No.
Any unpleasant awareness of like a forceful heart rate?
No.
Okay. Do you have any burning, cramping sensation in your lower legs when you walk like a short distance?
No.
Okay, lastly, do you have any known heart murmur?
No.
No, okay. So now we'll be moving on to step 4. So for step 4 first, can I check what is your current level of physical activity?
So I run or jog 2 days a week.
Okay, so what would you say is the intensity? Like moderate, like you jog? Light to moderate, huh? So you walk or jog like 2 days a week, is it?
Yeah.
Okay. So for our current physical activities, what is your desired level?
Moderate, I would say.
You want a moderate exercise intensity, huh?
Yeah.
Okay, yeah. So with all the information you've provided with me, I'll now share with you the results of the screening, okay?
Yes.
Okay, Changwei. So since you have, with all the information you have given me, actually we can see from this chart your results are that because you don't participate in regular exercise, right? Only twice a week, and it's like light to moderate, and it's not consistent. But you do not have any known diseases, and you don't have any signs or symptoms, right? That's suggestive of diseases. Medical clearance is not necessary, okay? And you can actually start exercising at light to moderate intensity. Then gradually, right, the more we exercise, we can progress to more vigorous intensity exercises. Is that okay?
Yeah.
Alright. Okay, Chen Wei. So that concludes the pre-participation screening. So for our next session onwards, as I have stated, we'll actually be doing fitness assessments. So I'll just have to give you some instructions that you need to follow, okay? Because the fitness assessment requires you to be in a certain state, okay?
Yes.
So for our next session, do come in comfortable attire like the one you have today. So your workout attire along with covered shoes, okay? Ensure you get enough rest the day before, because you know you want to do your best in the assessment. Then we'll get an accurate test result, okay? Do not consume any alcohol, caffeine, food or tobacco 3 hours before the test, as this might hinder your results, okay? Also do remember to hydrate yourself the day before and the day itself. And if you have any medication that you're on, do consult with your physician if it will affect your performance. And if it will, okay, if your physician says that it will affect your performance, you check with them if you are able to just stop it for that day. And also lastly, if you need someone to bring or follow you home after the assessment, do make your personal arrangements or do let me know, okay?
Yeah.
And that concludes our first session. Thank you, Chen Wei.